Most modern CT scanners can be used for routine cardiac imaging when the fine structures of coronary arteries need to be visualized. This is because, with the help of medication, you can slow down the heart to expand the diastolic phase. Under these conditions, you can acquire images without motion artifacts using single-source scanners. But the slow temporal resolution of such systems means that, regardless of how wide the detectors are, you run into problems once heart rates exceed 70 beats per minute. It's a completely different story with dual-source CT. When single-source scanners run out of speed because the available stationary period during the diastolic phase is simply too short, dual-source CT scanners can still keep up. Despite the significant temporal resolution benefits, it is possible for the diastolic phase to become challenging even for dual-source CT. This can happen when you're dealing with tachycardia or high heart rates in pediatric patients. Likewise, arrhythmia and congenital heart disease make things difficult as well. In all of these cases, the diastolic phase is too short or often unpredictable, resulting in motion artifacts that affect image quality. Single-source scanners offer two options for scanning under these conditions. The first one is to use multi-segmented modes that scan the anatomy several times starting at different positions and then combine the separate images. You end up with an increased radiation dose for just one poor quality image. The second option is to use software-based solutions to improve temporal resolution. The intent is to correct for a poorly measured scan, but there are significant limitations associated with this method. Of course, yet another option with single-source scanners is to accept that imaging at high or abnormal heart rates will generally be lower in quality, and just try to use them anyway. Single-source scanners struggle to provide optimal results under these conditions because of clear physical limitations. But with dual-source CT, you can simply turn to the systolic phase when you need to scan patients with tachycardia or arrhythmia. This phase remains stable and predictable for all patient groups. Dual-source CT scanners offer such high temporal resolutions that the image acquisition neatly fits into the systolic phase of the cardiac cycle. This enables you to achieve cardiac scans of exceptional quality in even the most challenging cases.